Here on WAJR's Ask the Experts. Thanks so much for being with us. It's brought to you by Healthworks Rehab and Fitness. Clinical Director at the Cheat Lake location, Jordan Feathers, is one of our guests, and we're also joined by Dr. Brendan Balcik, who is the WVU team physician, one of the WVU team physicians. There are how many total do we have?
Total, we have 4 primary care sports and then 3 orthopedists.
Yeah, so like
7.
That's a team. That's 7. That's 7 folks that are day in and day out taking care of the Mountaineers. He's also a primary care sports medicine person, and as I said, assistant professor of the Department of Emergency Medicine at WVU. And we're talking about pain management. And so we've gone to the point where how long do you wait before you go to see someone about the pain? And then using physical therapy oftentimes can be extremely successful. It is not necessarily a medication or an MRI that needs to be done. Let's jump ahead. Let's say that someone does do well with the program that they have been presented. How does, number one, keeping up to date with yourself at home, and how important is home exercise or physical therapy? And then when do you need to go back and see your doc?
Well, that's, in our name, Healthworks Rehab and Fitness, our job is to help keep you healthy. If a problem continues to persist, we didn't really do the full job that we were supposed to do. So we want to help you get pain-free. And then continuing the home exercise program that we've set up for you, as well as we're going to help you transition more towards just a healthier, well state of being. We want you to continue exercising and adding to that aerobic capacity. All the things that we know help you stay healthy in the long run, we're going to help you transition to that and turn you over to maybe one of our fitness professionals to help maybe in some personal training and motivate you, get you moving along in the right direction.
Dr. Balcik, is that the greatest satisfaction that you get, to see someone that comes in and they're not doing well, they're hurting, and then to watch the transformation and to see them healthy again? Is that the reward?
Oh, absolutely. I think if we get somebody that says they haven't been able to run for a week, a month, a year for that matter, and they go through a course of physical therapy and they're able to get back and do what they want to do, that's the best news.
I asked you guys in the last segment, what's the biggest thing that frustrates you from a patient standpoint? I'm going to ask you another question. What's the best thing that we can do to try to stay ahead of the curve of pain? In other words, as we get older, let's face it, when you get out of bed as you get older, chances are it's not going to be as painless as it used to be. What do you think we all can or should do to kind of help be preventative rather than reactive?
I'll say BJ touched on it earlier with stretching and flexibility. As we get older, maybe we're sitting at a desk job all day and your hamstring muscles are getting tight and your shoulders are getting stiffer and tighter. Your neck starts to get tighter. Flexibility really plays a big part in that. It can be yoga based. It can just be a general, stretching program when you get up in the morning. Staying flexible, mobile, even more so than strength is a big proponent in staying healthy.
Yeah. We almost went a whole show without using Dr. Balcik's initials, but you popped it in there. That's how I know. I only know him as BJ. I've never called him Dr. Balcik before. But BJ, what would you say?
I agree. I think people need to stay active as possible, and whether it's stretching, walking, running, biking, swimming, whatever it is that makes you feel good, keep doing it.
Okay. So we talked about non-compliant patients earlier. What do you do on a regular basis for stretching? I want the Jordan Feathers. I want the Jordan Feathers protocol, and I will confirm this with your wife. So let me know. What is it? What do you do?
Well, then I'm not even going to try and make something up. No,
you're not.
No, luckily, I've been blessed with not being painful. I had an ACL injury when I was young and did my 3 months of PT, and since that time, I've never had any issues with it. And I'm typically a pain-free person. I really don't have too many troubles.
It's coming. All right. Dr. Balcik, what do you try to do so you do stay flexible?
I am the worst patient. So I am actually a Healthworks member and patient myself. So I try to run and just be as active as possible.
You guys make me feel better as a non-compliant. So here we go. 3 non-compliant people encouraging you to get help for your pain management. In all seriousness, when and if it does happen to you, know that you've got world-class care right here in Morgantown, from WV Medicine to Healthworks. Guys, we do appreciate you coming in, and we wish you guys the best. Thanks so much.
Great. Thanks
Thank
for
you for having
having
us.
All right, Dr. Brendan Balcik and Jordan Feathers. That'll do it for this edition of WAJR's Ask the Experts. Stay with us. More coming up here on WAJR.